G'day, I'm Mia Friedman and I'm just popping into your ears to share an episode that I thought might resonate with some of you. Today is International Pregnancy and Infant Loss Remembrance Day, a day that is very close to my heart. I have had a couple of miscarriages and one particular one about halfway through my pregnancy that I've written about, and that when it happened to me at the time, I felt incredibly alone, which is why I wanted to share an episode of our podcast, Get Me Pregnant, our no BS guide to assisted fertility, about how to get through this extremely difficult time.
This episode is brought to you by IVF Australia, Melbourne IVF, Queensland Fertility Group and Tas IVF.
Welcome to Get Me Pregnant, your no BS guide to assisted fertility. I'm Rachel Corbett. I am head of podcasts here at Mamamia, and I am flying the flag for the solo lady who's thinking about having babies on her own, and I'm terrified.
I'm Lee Campbell. I'm executive editor of Mamamia. I have done IVF and I have a little baby boy.
You need to stop telling me how hard it is because I'm freaking.
Sorry, I know every time I come into the office, I'm like, don't have a baby by yourself. No, but I don't mean that. All I mean is it's bloody hard, but amazing and rewarding.
Yes. Well, today we're going to focus on some really tough parts of the process, and that is miscarriage and how you go through that and deal with the loss on the other side. But first, we have got our delightful fertility expert, Manuela Toledo, back in the studio. Hello, Manuela.
Hello.
Now, this is a very serious topic that we need to get to, but a very important one.
I'm going to kick off because I want to know, and I know from experience the answer, if we get a positive test during IVF, are we in the clear? Are we in the clear when there's a fetal heartbeat? Basically, are we ever in the clear?
So the positive pregnancy test 10 days after the embryo transfer is the first of a very long pregnancy journey. It means the embryo has attached, it's implanted, it's established a blood supply, and there's the beginnings of a placenta. So it's a really, really good first start.
But from then on, it's just like a normal pregnancy in terms of miscarriage can happen, anything can kind of happen. You're kind of like, okay, I'm pregnant now, we've got to go down that road.
Unfortunately, the risk of miscarriage is still there, regardless of whether it's an IVF pregnancy or naturally conceived. And the chance of miscarriage is highest in the first 12 weeks of pregnancy. It is also related to the age of the egg with which the pregnancy was created.
How common are miscarriages generally?
Miscarriages are really, really common. A lot of women would have a miscarriage so early on that they might not even realise it's a miscarriage. It might just be a delayed, heavier period than usual.
There's so many terms around miscarriage and pregnancy loss that I think it can be a bit confusing. There's ectopic or late or early or missed miscarriage. Can we run through a few of those, if you don't mind, just to define what's going on? What's the difference between an early miscarriage and a late miscarriage?
There are many terms, you're absolutely right, and it's super confusing. So an early miscarriage is a miscarriage that happens prior to 12 weeks, and the majority of miscarriages are between 6 and 10 weeks of pregnancy. Hence, we're very keen for everyone who's pregnant to have a 6-week ultrasound so that we can see the heartbeat and make sure it's absolutely in the right spot.
What is a blighted ovum?
A blighted ovum is a very old term that we don't really use very much anymore, but essentially it means on the ultrasound at 6 weeks you can see a sac, but the sac is empty. You can't see the fetus, which is the beginning of the actual pregnancy. You can't see that, and you certainly can't see a heartbeat either.
I experienced this, a missed miscarriage. What's that?
A missed miscarriage means that you've miscarried, but you're not bleeding, you're not in pain, you're completely unaware until you go in for that ultrasound and someone says, oh, I can see the pregnancy, but there's no heartbeat. Really, really difficult, because at least if you're having a bit of bleeding, you kind of have a bit of a heads up that something might not be right.
And what's a threatened miscarriage?
A threatened miscarriage is when you're actually bleeding. Bleeding in early pregnancy is actually quite common, and a lot of women who bleed in early pregnancy are absolutely fine. The pregnancy is fine. But we do talk about a threatened miscarriage, which means you need to come in, you need to get checked out, you need to have an ultrasound.
And what quantifies recurrent miscarriage? How many is happening there?
Recurrent miscarriage is more than 3 miscarriages in a row with no live birth in between. Having said that, after 2 miscarriages, a lot of women are very worried and very devastated. And even after 1 miscarriage, I'll see people who want to be fully investigated to make sure there's nothing going on that might increase their risk of another miscarriage.
What about complete and incomplete? What's that mean?
Complete means that your body has completely evacuated the pregnancy. So you've had a heavy bleed, we do an ultrasound, there's no evidence of the pregnancy is there anymore. An incomplete means that you've had a bleed and we have a look, but there's still some pregnancy tissue left behind.
What are the causes of miscarriage?
The overwhelming common cause of miscarriage is a genetic abnormality in the pregnancy. There's something wrong in the pregnancy genetically. That means it just can't go that next step. It can't go on to a 9-month pregnancy with a live baby at the end.
What about some of the other things? I know that's super common, but is there, I think, Lee, you were saying about you had some immune issues. Like, can it be an immune problem?
Absolutely. I mean, the common cause is a genetic abnormality in the pregnancy itself. There are some women who have immune issues where their pregnancy is being rejected by their immune system. Fortunately, this is actually not that common, but it is something that is potentially treatable if we go looking for it.
I think that there's a lot of pressure on women through this process, and guys are often thought to just be able to, you know what, you're an 80-year-old man, you can have a baby, time is on your side. But I was reading a bit about how the quality of sperm in men over 40 actually increases the risk of miscarriage. So it's twice as high for a woman whose male partner is over 45 than under 25. This, I feel like, is news to us because I think we've forever been told that men have no timeline.
And men have less of a timeline than women. I think that's correct. But what you say is absolutely accurate, that over the age of 45, men's sperm does decline, especially if you're a smoker. And I did warn you right at the beginning of this that we'll keep coming back to the smoking. But if you're the partner of a smoker, then your chance of miscarrying is tripled compared to if your partner is a non-smoker, regardless of your age or your partner's age.
And after 40, men's sperm does decline in quality.
It does decline in quality, and that's why certainly most of the big IVF units in Australia and around the world do like their sperm donors, to be under the age of 45.
What are your options or avenues if you are miscarrying? For example, when I had a missed miscarriage, I was given some options there. What are those?
So one option is that, depending on what gestation or how far along you are, one option is to induce the actual miscarriage and make you have a bleed by using some medication. That can cause a lot of cramping. It can be very uncomfortable, and you do need to be supervised medically if you're going to go down that path. But it is a good option for women who want to try and avoid having surgery, because the other option is to come in to a day hospital and have a surgical procedure known as a suction curettage, where we actually evacuate the pregnancy from the uterus.
And can you just wait it out till it all happens naturally?
That's definitely an option as well. A lot of women who know they've miscarried do not want to wait. They want to get on with it. They want to get a period so they can try and achieve a pregnancy again. But waiting is an option, and I do offer that to most of my patients. If you've waited for more than 2 to 3 weeks and nothing has happened, we start worrying about a risk of infection. And so at that point, we would then talk to you again about the medical or the surgical options. And I'd just like to say that if you do have the surgical option with a curettage, one of the advantages is we can send the pregnancy tissue off to analyse it genetically to see why did you miscarry. And that can be very helpful.
What about preventing miscarriage? Is there any way that you can do that? Or if your body's going to do it, it's just going to do it?
So miscarriage in the first trimester, which is the first 12 weeks of pregnancy when it's the most common, is difficult to prevent. I mean, obviously we don't want you to have any trauma to the abdomen. Women who've been involved in a car accident are more likely to miscarry. Any strenuous exercise might increase your risk. But really, at the end of the day, most women, there's not much they can do to prevent miscarriage in the first 12 weeks other than if they were taking party drugs or smoking or drinking a lot of alcohol.
How long after a miscarriage should you wait to try again, or does it not matter?
The old-fashioned advice is wait 3 months, and most of my patients do not want to wait 3 months. We normally start again with cycle tracking or ovulation induction or even IVF after one normal period. If the patient feels she's ready, both physically and psychologically.
I know miscarriage is a really difficult thing for women, but could you see it as a good thing in that it's your body doing what it's supposed to do?
And I'm really glad you brought that up, Rach, because it is kind of a good thing. Women who have a pregnancy, even if they miscarried, are far more likely to go on and have an ongoing pregnancy and a healthy baby at the end of it. So from our point of view in fertility land, when we see someone who's had a miscarriage, we we know that their chances of an ongoing pregnancy down the track are actually really, really good. But it is difficult because it's such a devastating event, and the last thing we want to do is pat someone on the back and say, hey, congratulations, you know, you had an early pregnancy. But it is actually, from a medical point of view, very encouraging.
I think it's just amazing that the body knows this isn't right.
Good. Yeah. Emotionally, obviously, it feels devastating. But yeah, you're right.
It is. And when you think about it, our mothers and grandmothers and great-grandmothers all had multiple miscarriages. They also had multiple children, and they started conceiving much, much younger. And it was just a way of life, whereas nowadays we're only looking maybe at having that 1 or 2 pregnancies, and we want everything to be perfect.
We so do. Chromosomal abnormalities are obviously the most common cause of miscarriage, and when you're over 38, the risk increases, right? I think this is a good one for Rach. If she waits till she's 42, but her eggs in the freezer are 36, where's the factor there? Is it the fact that she's that age, or that the eggs were frozen at that age?
So that's the really big advantage for people like Rach, who froze their eggs in their mid-30s, is that you've kind of frozen the goodness of your eggs in time.
Yippee!
So when you go to use them as a 41 or 42-year-old, your chance of miscarriage is actually reduced at the level of that of a 36-year-old.
Oh,
you're frozen in time.
So that's really advantageous.
That's awesome.
And if you're trying naturally and you do have a certain amount of miscarriages, is there a magic number you should go see a fertility expert?
I think that's a really, really good question, and I'm happy to see anyone at any stage. So if you've had one miscarriage and you're absolutely devastated and you want some advice on how you could possibly reduce the risk next time round, very happy to sit down and have that talk and do some tests and reassure you. I see some women who come in after 4 miscarriages and they've just been really stoic and gone it alone. Not many women like that. And even if you think you're coping, maybe check in with someone to see if you really are. And we can't forget the partner either. This is really devastating for the partners. They often blame themselves and they don't understand why would the pregnancy miscarry? What is it that we've done? So I think if you're having those kinds of thoughts or conversations, then come in and we'll sit down and we'll talk about it.
I think women often blame themselves if they do miscarry. I know personally I had scented candles in my house and I thought that was why I miscarried. Obviously no party drugs, no booze and stuff like that. But are there things we shouldn't do, like really hot baths and things like that in that first trimester?
Women do have that tendency to blame themselves, and we see that in all aspects of our lives. There's not much you can really do to bring on a miscarriage. We do advise you not to raise your core body temperature. So your core body temperature, and we discussed this in a previous episode, is 37.2 degrees. And embryos and early pregnancies like to be at that temperature. So if you have a high fever or an intercurrent illness, that's not great. We also avoid long hot baths is probably not great. Sitting in an onsen at 42 degrees, probably not advisable in early pregnancy. Does it actually induce miscarriage? I don't think there's any studies out there on that, but it is something we would prefer you to avoid.
If you have had 3 miscarriages, do you still have as good a chance of getting pregnant after that as somebody who's just had 1 or none?
Look, thanks for asking that. That's a really good point, because even if you've had 3 miscarriages, which is absolutely devastating, in actual fact, your chance of an ongoing pregnancy 4th time round is still really, really good. But it is time to be investigated. It is time for you to come in and let's do all the tests and make sure that we're not missing something that we can treat for you.
Manuela, thank you so much for all of your knowledge and your expertise. I feel like we're really helping people.
Thank you for having me in. It was great. Thank you.
1 in 6 couples struggle with infertility when trying to conceive, and no 2 fertility journeys are the same. You may share the dream of parenthood with many, but everyone is unique. That's why IVF Australia, Melbourne IVF, Queensland Fertility Group and Tas IVF ensure their fertility services are not only the best in the world, but they're tailored to your needs. If you've been trying to conceive for longer than 6 months, it might be time to check in with a fertility expert. Start with a fertility checkup. It's the best place to start for the right advice. Write your own success story with IVF Australia, Melbourne IVF, Queensland Fertility Group and Tas IVF.
We're welcoming back Anne Coffey, our fertility specialist who also specialises in recurrent miscarriage. Welcome back, Anne.
Thank you.
Now, this is a really emotional time, particularly if there's a lot of kind of hopes and dreams wrapped up in the process of trying to have a baby. So you've obviously made the decision to go and do IVF. You've finally gotten a positive pregnancy result and then you miscarry. How do you deal with that?
I guess this reminds me a lot of my own personal experience. We'd tried for 2 years before I was pregnant for the first time. I just couldn't believe I was. It took me a long time to get my head around the possibility that this might even be happening. And just as I think I really got my head around it, it was all over. I'd felt during that time of trying like I was sitting on the outside of this club I really, really wanted to be a part of. And I had my foot in the door. And it was all going to happen, and then the door slammed shut in the most devastating way. Miscarriage in this context is devastating. It is a significant loss. It's not just the loss of a baby, it's the loss of all the things that baby represented, the hopes and dreams, the life imagined. And so, of course, this is a significant loss that deserves to be grieved. And there needs to be room for that grief and whatever course that may take. The thing I learned in my experience was that our society is really bad at providing space for grief. We have a really poor culture here around grief. And if we could just be better at it for ourselves and for those around us, this would make the infertility journey so much easier. We're taught from a really young age that grief is this process that's fixed with stages. And the truth is that framework is not based on any scientific evidence. It's not a valid model of grief. And the problem that it creates, especially in couples, especially in family systems that are dealing with this, is that it creates the idea that everyone's supposed to go through certain stages and express certain emotions. And it's simply not true. The largest body of recent scientific literature on the grief process tells us there is no set process, no set emotional reaction that people need to have, and that grief involves a mixture of positive and negative emotions. This body of literature coined the term coping ugly. It involves a lot of ugly emotions too. My primary reaction was anger, and it was tiring. It was really tiring being that angry for a long time. And at times I wished I could just be sad because that was easier. So there is no process. Where there's an idea of process, this creates discordance in relationships because people can be dealing with things in their own way. The good news, though, is that the body of literature that I'm talking about here also tells us that humans are highly resilient. So, yes, of course, there are these reactions that we need to process. This requires an enormous amount of support and time, but humans are highly resilient and find their way through and make meaning of these events.
You mentioned feeling both anger and sadness, and unless a woman or a couple have been through it, I think they might be surprised to learn that there's oftentimes a lot of shame as well and a lot of guilt. Why do we feel shame and guilt, and how do we process those emotions?
So the commonest conversation I have with couples after experiencing miscarriage, especially in treatment, but in all contexts, is the conversation around, was it because I did this or I didn't do that? So guilt just seems to be such an inherent part of this process. And in particular, it's something that women often feel. Again, it's the fact that it happened in their body, so they feel this enormous burden of guilt. The reason we do this, the reason we seek these answers is because we need to make sense of these big events when they happen in our life. There's an incredible sense of loss of control. And so it's understandable that people explore these questions, and I take a lot of time with people to address every question because it must be addressed at the time. Again, keep in mind that sense of failure and shame is locked into an idea that deep down that the person is somehow responsible, when of course they're not. The majority of miscarriages at all ages are to do with incorrect combining of DNA, of the sperm and egg DNA. That's an amazing process, having that work well and then be replicated in the first few replication cycles of those cells. And we're not in charge of that.
What about women or couples who are at the end of the road? They've either never been pregnant or they don't have a child and that's it for them. How did they process what they're going through, and is that a different and unique kind of grief?
I guess there are some different and unique elements to that, but at the end of the day, it is still, of course, a profound loss, and it is still the profound loss of hopes and dreams that were invested in the plan for being parents and for the life that would create. And so it's a profound loss that requires recognition, it requires, respect, and it requires grieving. Very supported though, and that's something where psychologists can be very beneficial, and there's some wonderful online support networks in both Australia and in the world that support people moving through this.
All right, fact or fiction time. We're going to answer some questions that people have about assisted fertility.
So if I experience miscarriage through the IVF process, is that my uterus rejecting the pregnancy?
No, and of course it's never quite that simple. But this goes to a really common, sometimes unconscious perception that people form around their fertility, both in the context of infertility and miscarriage. And what can happen is they can form this idea that there's something wrong with the uterus. It's hostile and it doesn't allow the pregnancy to stick. It's a language that's used all the time. Keep in mind that the majority of miscarriage, again, is due to this incorrect combination of how the genetic material comes together. So therefore it's in the embryo. And embryo factors are still the dominant thing that determine miscarriage and have a significant effect on fertility issues as well. So the uterus has a really important job of screening those embryos. That's part of what it needs to do. It needs to decide if the embryo is of good enough quality to allow implantation. So yes, there are some diseases and issues where there can be a problem in the uterus and endometrium that can impact on fertility, but most of the pregnancy loss we see will be embryo related.
This question fits in a lot when women are pregnant and they're thinking, oh gosh, is walking a certain way going to make me miscarry? Should I do a star jump? Is that going to be a problem? If you lift heavy objects, can that cause a miscarriage?
No, and this is the sort of question that comes from women worrying about lifting their children or just their jobs, thinking, gosh, should I lift that box or not? Keep in mind that in very early pregnancy, that pregnancy is a very, very small structure safely protected within the walls of the uterus, deep down within the bony pelvis. It's not even outside of the pelvis at that stage. So heavy lifting does not impact on those processes in the general context of our day-to-day lives.
Wonderful. And can stress, that big old S word, can that cause a miscarriage?
Again, a really commonly held belief in the community and a dangerous idea, because the implication is, I was stressed, I made this horrible thing happen to myself. But the answer is actually yes and no. So there is scientific literature that shows a small, measurable effect of stress on the rate of miscarriage at a population level, but usually in the context of populations under intense stress, so people in conflict zones. Keep in mind also that stress can contribute to behaviours that can increase the risk of miscarriage, like smoking and alcohol intake. But as an independent factor, the sort of stress we experience just dealing with our families, our work lives, there's insufficient evidence to say that could independently cause a miscarriage. And keep in mind that those embryo factors, those genetic factors, still are the dominant cause of miscarriage.
Good to know. Thanks so much, Anne.
Thanks for coming.
My pleasure.
Well, I think it's really good to know that just because you've had a miscarriage or even 3 miscarriages, you've still got a really great chance of being pregnant, because I think a lot of women think, oh, it's just never going to happen for me.
We called it a day. We thought we were done. We bought a very expensive designer white couch, and now we have a tiny baby making it filthy. So you never know.
Next episode, we're going to be talking about fertility preservation, which is just a fancy way of saying freezing your eggs and your sperm. Maybe you're doing that because you are getting older and you want to give yourself some options. Maybe you've been given a medical diagnosis and you need to do that. So we're going to step you through everything that's involved in that so you can know what the process is all about. If you are enjoying the show, please share it with people that might find it useful as well. It was produced by Bridget Northeast and Cecilia Ramsdale, and we will see you next week.
Goodbye.
This episode was brought to you by IVF Australia, Melbourne IVF, Queensland Fertility Group and Tas IVF.